Hi, I'm Dr. Jared Nielsen here in Heber City, Utah. I'd like to mention an important nutritional supplement that our body already produces, but oftentimes is in deficit and therefore requires some type of external introduction. The supplement I'm referring to is acetyl glutathione, or simply glutathione. Glutathione is the highest occurring natural antioxidant in our bodies, but oftentimes is impaired in its ability to be produced. Many people use some of its precursors in the form of N-acetylcysteine, or NAC. When we look at the utilization of glutathione, the liver is where we primarily find glutathione stores being consumed. It has a benefit in the liver because there are two phases or pathways the liver utilizes to eliminate toxins or waste byproducts. Let me give you an analogy. Suppose you take a small cup down to a stream and you skim the stream and drop water into the cup. As you let the cup set, you notice that there's a separation of the heavy sediment to the bottom of the cup, and yet still in the solution or in the water, a precipitate that's just hanging out. Phase 1 detoxification of the liver can filter off that light sediment from the water or the fluid. Phase 2 detoxification of the liver is more the heavy sediment that's drawn out of the liver. So glutathione assists both pathways, but especially for getting out the heavy sediment that may settle in our systems. For example, heavy metals, the detoxification pathways associated with metabolism, and also the presentation of autoimmunities where we see antibodies or elevation of histamine and other neurotransmitters that stimulate or excite inflammation in the body. So when we take oral glutathione, the liver is so hungry for it, oftentimes the majority of the glutathione is consumed in the liver. Another means of delivery of glutathione to especially affect the brain is the delivery system that Dr. David Perlmutter, a medical neurologist in Naples, Florida, uses. And this is either an intramuscular injection or an IV introduction of glutathione into the body. In many cases, 800 to even 1,200 milligrams of glutathione can be introduced via IV, and a tremendous benefit for the brain is achieved, especially for, again, patients with neurodegenerative diseases such as Parkinsonism, or more advanced neurodegenerative diseases like Lou Gehrig's disease or multiple sclerosis. When we look at the benefits again of the glutathione, the reason that the person experiencing a neurodegenerative presentation, for example Parkinsonism, is benefited by glutathione is the fact that glutathione acts as a recycler of neurotransmitters. So when we look at a person again with Parkinsonism who's developed a decreased or diminished output of dopamine, we can actually recycle the amount of dopamine that's present, and we get a very, very rapid, in fact, within 5 to 15 minutes, an observable change in the person's ability to walk, to turn, or to feel like they're stable on their feet, and their facial expressions increased just by using glutathione either as an IV or some type of intramuscular injection. In our office, we utilize a glutathione gel that actually is a transdermal delivery, or across the skin. You apply it to the skin and it will actually take up through the bloodstream and therefore be delivered to the brain before being consumed in the liver. The only challenge is glutathione has a very strong sulfurous smell because, again, it has that ability to draw and to detoxify. The sulfuric donors or the methyl donors have a very strong pungent odor. So therefore the odor is sometimes a challenge for people to use. Again, if we're trying to target the liver, an oral delivery system may be optimal through a capsule. Again, the one drawback to the glutathione utilization is it does have a pungent odor, but the benefit is tremendous. When we look again at neurodegenerative diseases, when we look at autoimmunities, particularly of Hashimoto's thyroid, glutathione is essential to reduce the antibody response, and you actually see the inflammation of the thyroid diminish over a period of weeks. This is very important for us, particularly for those experiencing the goiter or enlarged thyroid presentation of an autoimmune thyroid disease. And the benefit of that is not only cosmetic, meaning the appearance of the individual, but also the thyroid tissue can be preserved and therefore not have to experience the thyroidectomy or the surgical removal. Patients who've utilized glutathione for a period of time note the benefit of healing, the benefit of change in thyroid tissues, and also their energy, because glutathione assists in recycling also the thyroid hormone production. As we look at the body as a whole, again, glutathione is one of the most important and highest produced, but when the pathway is impaired, that antioxidant is unavailable. So utilizing a supplement that stimulates either thyroid activation or liver activation and the production of glutathione, again in the form of N-acetylcysteine, or delivering glutathione directly to the system can have a tremendous benefit. Because it is a detoxifying agent or an antioxidant and detoxifying agent, remember that utilization of glutathione in some patients may develop an opposite effect, meaning for a period of time they may feel a little bit worse. That's to be expected when we again note a benefit. Remember, anything that has a potential effect may also have a potential side effect. Again, I'm Dr. Nielsen. I hope this is a help to you.